been caring for far north Queenslanders since 1878. More than a century later, it has become the beating heart of healthcare in the far north and one of the busiest hospitals in regional Australia. It also has some of the best views for Queensland patients that are staying there. But for decades, our hospital staff's pleas fell on deaf ears. There were promises of a new hospital, a new helipad, a new car park and better facilities, yet nothing was delivered. In fact, an independent review of the former government's capacity expansion program found that not a single new or expanded hospital project was expected to be delivered within its original funding envelope or delivery timeframes, and that included the Cairns Hospital. This is a hospital that serves almost 300,000 people annually. On average, every week, there's 132 patients that receive elective surgery, 44 babies are born, 1,601 people present to the emergency department, and 1,757 people are admitted to hospital. Yet, under the former Labor government, Cairns Hospital was operating under enormous pressure, with inadequate parking, an unsafe helipad located near a popular walking park, and outdated facilities. It was a hospital without adequate services to treat many trauma patients, forcing way too many people to travel south to Townsville and Brisbane for specialist treatment. So this bill, together with the Christopher government's hospital rescue plan, is changing that. This bill is addressing several shortcomings left by the former Labor government and provides Queensland Health with the tools that it needs to plan and deliver critical healthcare infrastructure. The Health Legislation Amendment Bill 2026 makes a range of important amendments across Queensland's health legislation, including hospital governance, mental health laws, public health measures, tobacco enforcement, and community pharmacy regulation. Most importantly, for growing communities like Cairns, it supports the hospital rescue plan by enabling Queensland Health to acquire land more efficiently for future health infrastructure projects. Now, that might sound like a technical change, but it is a practical reform that removes unnecessary barriers to delivering hospitals, health services, and infrastructure where they are needed most. And we are already seeing the benefits of a government focused on delivery. Just last week, we opened a new 32-bed ward with the Premier and the Health Minister, and construction is moving hard and fast thanks to the incredible team at Hutchinson's Builders, and I particularly welcome the addition of 4 new trauma beds. This means people injured in serious accidents, whether on the roads, farms, workplaces or from crime, can receive treatment closer to home. We will also deliver another 32 overnight beds by 2027, and our new $1 billion Cairns Hospital master plan includes a 40-bed innovation and surgical centre, a new helipad and in a safer location, a multi-storey car park and new administration buildings, all to be delivered by 2031. Our construction continues, and unlike the former government's approach, our hospital rescue plan has been designed for Cairns and with Cairns clinicians. I recently spoke with several of the hospital's senior staff who explained just how different this process has been compared with their experience under the former Labor government. This new plan provides cohesion. It has been designed by clinicians, directors and board members and the hospital staff that work in the hospital every single day. It delivers a streamlined approach, improved patient flow, greater capacity to treat complex patients, and facilities that healthcare workers have been asking for years. A health management hub, world-class training facilities, toxicology centre, a dedicated staff car park that will also free up spaces for patients and visitors, and a more connected campus with link bridges joining key clinical services, allowing staff to move patients more efficiently throughout the hospital. Most importantly, it gives clinicians the tools they need to provide better care. Mr. Speaker, our government has listened. We listen to the clinicians, the directors, the nurses, the doctors and allied health professionals. This is a hospital for Cairns designed by the people who work in Cairns and shaped by their expertise. Compared to the former Labor plan, it's like chalk and cheese. Labor failed capacity expansion program left the Cairns Hospital project with a $378 million cost blowout, increasing from $250 million to $628 million. There was no funded plan for a surgical centre, no funded plan for a multi-storey car park, and no clear pathway to deliver the infrastructure that Cairns needs. Now, last week, the member for Cairns posted a little sad selfie video claiming it was his government that set the Cairns Hospital expansion in motion, but Labor's mismanagement of the capacity expansion program resulted in major delays, billions in cost blowouts, and significant design flaws across major hospitals across the state. The staff were so concerned about the layout of the hospital, how inefficient it was, how ineffective, and that it didn't meet the needs of our growing region. On top of that, the CMFEU labour tax, increasing the industrial settings, also contributed to rising costs. Independent analysis found Queensland construction productivity lagged other jurisdictions, resulting in longer delivery timeframes and higher project costs. To deliver major infrastructure, though, you need more than announcements, you need a workable plan. And under the former government, layers of bureaucracy and red tape slowed projects to a standstill. So this bill directly addresses that problem. The amendments give Queensland Health the power to acquire land directly for health infrastructure purposes, including through compulsory acquisition when needed. That means that when projects identified in hospital master plans, such as the Cairns Hospital expansion, require additional land, Queensland Health can act more efficiently and avoid unnecessary delays. This is already the case with the Red Cross Association located across from the Cairns Hospital. The groundwork is already being laid in Cairns, and I am confident that Queensland Health will deliver an outcome that our community expects and deserves. What else is we're doing? This is not just about sod turns, it's about the results. So there's been a record number of doctors and nurses entering the health system, with more than 10,000 additional health workers already added. In Far North Queensland, we've had 6 cardiologists welcome to our region, including an additional paediatric cardiologist, which was really needed by our community. More than 900 people have come off local waiting lists, that's surgery waiting lists where people have sometimes been waiting for years. So 900 people coming off those wait lists is extraordinary. Ambulance ramping performance has improved and is leading our peer group. And the Patient Travel Subsidy Scheme has received an $11.7 million uplift, increasing assistance from 34 cents per kilometre to 45 cents per kilometre. Surgery Connect is funded at $1.8 billion over 4 years, including $247 million in 26-27 to deliver an additional 25,000 surgeries. The LNP Christopherly government is repairing a health system that suffered from years of neglect, and we're doing it through both infrastructure and reform. And this bill is about more than hospital buildings. It also strengthens Queensland's health system by addressing regulatory gaps and modernising legislation. One important example is the Pharmacy Business Ownership Act, because current laws prevent community pharmacies from being directly affiliated with supermarkets in the physical environment. And this bill ensures those same protections apply online. And this matters because medicines are not ordinary retail products. There must be a clear distinction between essential medicines and general consumer goods. Patients deserve professional advice, oversight and support from qualified pharmacists. And Far North Queensland is home to many family-owned pharmacies that provide essential healthcare services to regional and rural communities. People like Trent and Georgina Toomey, Matthew and the Kalana family, they've all played a significant role in shaping and supporting healthcare throughout our region for a long time. And a shout out to Matthew and the Kalana Pharmacy family, who recently celebrated 50 years of the Kalana Pharmacy brand in Cairns, an extraordinary milestone. But this legislation helps protect those local businesses and the communities that rely on them, and its aim is simple: to ensure pharmacies remain focused on patient care, not controlled by external commercial interests. And for many rural and remote communities, the local pharmacy is often the most accessible health service available, and this bill helps protect that model. So this bill is all about delivering a stronger, more practical and more responsive healthcare system for Queensland. It removes barriers to critical health infrastructure. It strengthens mental health and public health laws, protects community pharmacies and supports the hospital rescue plan that communities like Cairns desperately need.